buat masa depan. Ah, Pak, tolong ambil nggak sama.
Hani, Hani, Han. Iya, kita suaranya. Udah, oke. Lanjut lagi, udah. Pembukaan nanti ada video dulu kan. Udah kan?
Karena beliau presentasinya berarti setelah 9.20 kalau nggak salah tadi. Iya, karena BKPK dulu.
Ini aja. It is a pleasure to facilitate this session. Ya, pokoknya kata-katanya it is a pleasure to facilitate this session. Langsung aja mas.
Ya, oke.
Pak, tolong ambil minyak sama garam. Menunya tempe lagi ya, Bu. Iya, Dek. Uang Ibu cuma bisa beli ini.
Kamu kalau mau rekam Hani, rekam aja. Ya terserah sih, bebas.
Kalian masih sempat menyelamatkan negeri ini. Kalian harus tahu, di masa depan banyak orang yang kekurangan gizi. Banyak ibu yang selama hamil kurang gizi, bikin anaknya nggak tumbuh dengan baik. Anak-anak yang kurang gizi jadi terhambat pertumbuhannya, susah fokus di kelas, kecerdasan juga di bawah rata-rata. Orang tua dan lansia juga nggak produktif karena malnutrisi, sakit-sakitan, kantor kosong, sekolah sepi, negara kacau. Tapi sekarang aja kami cuma mampu beli tempe. Kalian pikir gizi cuma buat orang mampu? Semua kekacauan dimulai karena penolakan masyarakat. Pemerintah sudah berusaha mengadakan program fortifikasi pangan yang terbukti efektif mengatasi masalah kurang gizi dengan menambahkan vitamin dan mineral penting ke dalam bahan makanan sehari-hari. Sudah ada program perlindungan sosial bagi masyarakat miskin dan rawan pangan supaya dapat hak yang sama. Tapi masyarakat menolak. Fortifikasi diabaikan. Padahal itu harapan untuk mendukung perbaikan gizi masyarakat. Garam sama minyaknya habis. Pak, sekarang di garam yang ada yodiumnya sama minyak yang ada vitamin A-nya ya. Pokoknya untuk fortifikasi, Pak. Bu, itu siapa, Bu? Aku merasa lebih sehat. Sejarah mulai berubah. Masa depan telah selamat karena kalian telah menerima fortifikasi pangan.
Ya terus gampang. Yang penting ada datanya aja dulu.
Wah, ibu-ibu komplek harus tahu ini. Pilih bahan makanan yang
Tapi nggak
terfortifikasi
otomatis.
itu penting buat masa depan.
Kalau nggak harus ada emailnya di form.
Pak, tolong ambilin minyak sama garam. Menunya tempe.
Nasi yang kamu makan ternyata bisa ditambah lagi kandungan gizinya.
Iya. Emailnya penting enggak?
It is a pleasure.
Jadi gini, pada dasarnya beras sendiri sudah memiliki kandungan gizi seperti karbohidrat, protein,
Ininya,
hingga zat besi
ini udah
yang manfaatnya
ayam.
sebagai sumber energi.
Oh langsung ini ya?
Iya.
Nah,
Belum
berkat
ditampilin.
kemajuan
Kalau
teknologi,
bentar.
sekarang
Oh,
kandungan
oke,
gizi
oke.
beras
Berarti
bisa
langsung
ditambah
pasang
lagi
gitu ya?
dengan vitamin
Kalau
A,
nggak, dimatiin dulu.
B1, B3, asam folat, hingga zinc yang
Ini
manfaatnya
udah
bukan
live.
lagi
Saya
sekedar
matiin dulu.
sumber
Yang ini nih
energi,
videonya.
tapi bisa mencegah
Oh, videonya
kekurangan gizi
ini.
yang menyebabkan
Videonya bukan itu, yang ini nih. Nih.
Oh oke mantap.
Kita tampil di sini sih.
Ya di sini aja ya. Saya percaya bahwa Indonesia Emas 2045 hanya dapat terwujud bila kita menyiapkan generasi yang bebas dari kekurangan gizi.
Saat ini sudah ada 3 komoditas yang sudah dilakukan secara wajib.
Nanti ini selesai, balik lagi pagi.
Fortifikasi pangan adalah investasi fundamental untuk membangun generasi Indonesia yang lebih sehat, cerdas, dan produktif.
Amanat yang penting buat bangsa kita, khususnya untuk memperbaiki gizi buat kelompok-kelompok yang rentan dan juga marginal.
Mana ya? Mau ngeliat lagi? Masih mau ngeliat? Cukup. Cukup ya.
Pak, tolong ambilin minyak sama garam.
Nasi yang kamu makan ternyata bisa ditambah lagi kandungan gizinya. Mana bisa? Bisa dong. Jadi gini, pada dasarnya beras sendiri sudah memiliki kandungan gizi seperti karbohidrat, protein, hingga zat besi yang manfaatnya sebagai sumber energi. Nah, berkat kemajuan teknologi, sekarang kandungan gizi beras bisa ditambah lagi dengan vitamin A, B1, B3, asam folat, hingga zinc yang manfaatnya bukan lagi sekedar sumber energi, tapi bisa mencegah kekurangan gizi yang menyebabkan stunting pada anak, mencegah kekurangan darah pengangkut oksigen penyebab anemia, hingga menjaga kekebalan tubuh agar tidak mudah terserang virus. Nah, proses penambahan gizi ini dikenal dengan nama fortifikasi pangan. Indonesia mulai menerapkan fortifikasi pangan pada produk garam di tahun 1980 dengan menambahkan yodium dalam rangka menanggulangi penyakit gondok. Dan hasilnya, prevalensi gondok turun dari 27% menjadi 9,8%.
Terus apa aja yang udah di
Fortifikasi. Saat ini yang diprioritaskan adalah kategori pangan wajib, mulai dari garam, tepung terigu, dan minyak goreng sawit.
Lah, beras?
Sayangnya, beras yang merupakan jenis pangan pokok yang paling banyak dikonsumsi masyarakat belum difortifikasi secara merata. Dan kalaupun ada, harganya jauh lebih mahal dibanding beras biasa.
Solusinya?
Untuk itu, pentingnya fortifikasi pangan wajib masuk ke dalam program perlindungan sosial yang secara efektif akan fokus menyasar masyarakat rentan dan kurang mampu, sekaligus mencegah penyakit yang disebabkan oleh kekurangan gizi. Karena sejatinya, fortifikasi bukan sekedar menambah gizi, tapi jauh lebih besar dari itu, membangun generasi dan menentukan masa depan negeri ini. Nasi yang kamu makan.
Bayangkan, 1 dari 3 anak Indonesia berisiko mengalami stunting. Itu berarti masa depan mereka terancam hanya karena kekurangan gizi. Anemia, stunting, dan kekurangan vitamin A adalah ancaman nyata bagi masyarakat kita. Kekurangan gizi ini seperti piring kosong. Tanpa zat gizi yang cukup, tubuh dan pikiran mereka tidak bisa berkembang optimal. Stunting memengaruhi pertumbuhan fisik dan kecerdasan anak. Anemia menyerang produktivitas ibu hamil dan juga remaja. Kekurangan vitamin A itu bisa meningkatkan resiko penyakit yang serius. Masalah ini nyata dan jumlahnya masih sangat tinggi. Berdasarkan data dari UNICEF dan WHO, angka prevalensi stunting Indonesia berada di peringkat kelima dalam daftar negara dengan prevalensi stunting tertinggi di Asia, dengan angka 21,6% pada tahun 2022. Tapi ada solusi sederhana yang bisa dilakukan bersama, yaitu dengan fortifikasi pangan. Dengan menambahkan zat gizi seperti zat besi, yodium, dan vitamin A ke makanan pokok, kita bisa mencegah gizi buruk dan menyelamatkan jutaan jiwa. Indonesia memiliki fortifikasi pangan wajib untuk melawan kekurangan gizi, yaitu garam beriodium, tepung terigu dengan zat gizi, dan minyak sawit kaya vitamin A yang sudah diatur dalam regulasi pemerintah untuk melindungi kesehatan kita. Program perlindungan sosial seperti bantuan pangan menjadi lebih efektif dengan fortifikasi. Ini memastikan kelompok rentan tetap mendapatkan gizi yang cukup untuk hidup yang sehat.
Mari bersama kita dukung program ini karena gizi adalah hak setiap orang. Bersama kita bisa ciptakan Indonesia yang lebih sehat dan kuat.
Bayangkan.
Menunya tempe lagi ya, Bu? Iya, Dek. Uang Ibu cuma bisa beli ini. kalian masih sempat menyelamatkan negeri ini. Kalian harus tahu, di masa depan banyak orang yang kekurangan gizi. Banyak ibu yang selama hamil kurang gizi, bikin anaknya nggak tumbuh dengan baik. Anak-anak yang kurang gizi jadi terhambat pertumbuhannya, susah fokus di kelas, kecerdasan juga di bawah rata-rata. Orang tua dan lansia juga nggak produktif karena malnutrisi, sakit-sakitan, kantor kosong, sekolah sepi, negara kacau. Tapi sekarang aja kami cuma mampu beli tempe. Kalian pikir gizi cuma buat orang mampu? Semua kekacauan dimulai karena penolakan masyarakat. Pemerintah sudah berusaha mengadakan program fortifikasi pangan yang terbukti efektif mengatasi masalah kurang gizi dengan menambahkan vitamin dan mineral penting ke dalam bahan makanan sehari-hari. Sudah ada program perlindungan sosial bagi masyarakat miskin dan rawan pangan supaya dapat hak yang sama. Tapi masyarakat menolak, fortifikasi diabaikan. Padahal itu harapan untuk mendukung perbaikan gizi masyarakat. Yuk, garam sama minyaknya habis. Pak, sekarang di garam yang ada yodiumnya sama minyak yang ada vitamin A-nya ya. Pokoknya yang terfortifikasi, Pak. Bu, itu siapa, Bu? Cepet. Aku merasa lebih sehat. Sejarah mulai berubah. Masa depan telah selamat karena kalian telah menerima fortifikasi pangan. Wah, ibu-ibu komplek harus tahu ini. Pilih bahan makanan yang terfortifikasi itu penting buat masa depan.
Nasi yang kamu makan ternyata bisa ditambah lagi kandungan gizinya.
Mana bisa? Bisa dong.
Jadi gini, pada dasarnya beras sendiri sudah memiliki kandungan gizi seperti karbohidrat, protein, hingga zat besi yang manfaatnya sebagai sumber energi. Nah, berkat kemajuan teknologi, sekarang kandungan gizi beras bisa ditambah lagi dengan vitamin A, B1, B3, asam folat, hingga zinc. Yang manfaatnya bukan lagi sekedar sumber energi, tapi bisa mencegah kekurangan gizi yang menyebabkan stunting pada anak, mencegah kekurangan darah pengangkut oksigen penyebab anemia, hingga menjaga kekebalan tubuh agar tidak mudah terserang virus. Nah, proses penambahan gizi ini dikenal dengan nama fortifikasi pangan. Indonesia mulai menerapkan fortifikasi pangan pada produk garam di tahun 1980 dengan menambahkan yodium dalam rangka menanggulangi penyakit gondok. Dan hasilnya, prevalensi gondok turun dari 27% menjadi 9,8%.
Kodenya apa, Pak Jis?
Terus apa aja yang udah di
Pak Jis, kodenya apa tadi? Narasinya apa tadi?
Fortifikasi.
Kalau mau itu.
Saat ini yang diprioritaskan adalah kategori pangan wajib, mulai dari garam, tepung terigu, dan minyak goreng sawit.
Kasih tahu ya, aku tinggal konsen lain.
Sayangnya, beras yang merupakan jenis pangan pokok yang paling banyak dikonsumsi masyarakat belum difortifikasi secara merata. Dan kalaupun ada, harganya jauh lebih mahal dibanding beras biasa.
Solusinya?
Untuk itu, pentingnya fortifikasi pangan wajib masuk ke dalam program perlindungan sosial yang secara efektif akan fokus menyasar masyarakat rentan dan kurang mampu, sekaligus mencegah penyakit yang disebabkan oleh kekurangan gizi. Karena sejatinya, fortifikasi bukan sekedar menambah gizi, tapi jauh lebih besar dari itu, membangun generasi dan menentukan masa depan negeri ini.
Bayangkan, 1 dari 3 anak Indonesia berisiko mengalami stunting. Itu berarti masa depan mereka terancam hanya karena kekurangan gizi. Anemia, stunting, dan kekurangan vitamin A adalah ancaman nyata bagi masyarakat kita. Kekurangan gizi ini seperti piring kosong. Tanpa zat gizi yang cukup, tubuh dan pikiran mereka tidak bisa berkembang optimal. Stunting memengaruhi pertumbuhan fisik dan kecerdasan anak. Anemia menyerang produktivitas ibu hamil dan juga remaja. Kekurangan vitamin A itu bisa meningkatkan resiko penyakit yang serius. Masalah ini nyata dan jumlahnya masih sangat tinggi. Berdasarkan data dari UNICEF dan WHO, angka prevalensi stunting Indonesia berada di peringkat kelima dalam daftar negara dengan prevalensi stunting tertinggi di Asia, dengan angka 21,6% pada tahun 2022. Tapi ada solusi sederhana yang bisa dilakukan bersama, yaitu dengan fortifikasi pangan. Dengan menambahkan zat gizi seperti zat besi, yodium, dan vitamin A ke makanan pokok, kita bisa mencegah gizi buruk dan menyelamatkan jutaan jiwa. Indonesia memiliki fortifikasi pangan wajib untuk melawan kekurangan gizi. yaitu garam beriodium, tepung terigu dengan zat gizi, dan minyak sawit kaya vitamin A yang sudah diatur dalam regulasi pemerintah untuk melindungi kesehatan kita. Program perlindungan sosial seperti bantuan pangan menjadi lebih efektif dengan fortifikasi. Ini memastikan kelompok rentan tetap mendapatkan gizi yang cukup untuk hidup yang sehat.
Mari bersama kita dukung program ini karena gizi adalah hak setiap orang. Bersama kita bisa ciptakan Indonesia yang lebih sehat dan kuat.
sama garam. Menunya tempe lagi ya, Bu? Iya, Dek. Uang Ibu cuma bisa beli ini. Kalian masih sempat menyelamatkan negeri ini. Kalian harus tahu, di masa depan banyak orang yang kekurangan gizi. Banyak ibu yang selama hamil kurang gizi, bikin anaknya nggak tumbuh dengan baik. Anak-anak yang kurang gizi jadi terhambat pertumbuhannya, susah fokus di kelas, kecerdasan juga di bawah rata-rata. Orang tua dan lansia juga nggak produktif karena malnutrisi, sakit-sakitan, kantor kosong, sekolah sepi, negara kacau. Tapi sekarang aja kami cuma mampu beli tempe. Kalian pikir gizi cuma buat orang mampu? Semua kekacauan dimulai karena penolakan masyarakat. Pemerintah sudah berusaha mengadakan program fortifikasi pangan yang terbukti efektif mengatasi masalah kurang gizi dengan menambahkan vitamin dan mineral penting ke dalam bahan makanan sehari-hari. Sudah ada program perlindungan sosial bagi masyarakat miskin dan rawan pangan supaya dapat hak yang sama. Tapi masyarakat menolak, fortifikasi diabaikan. Padahal itu harapan untuk mendukung perbaikan gizi masyarakat. Garam sama minyaknya habis. Pak, sekarang di garam yang ada yodiumnya sama minyak yang ada vitamin A-nya ya. Pokoknya yang terfortifikasi, Pak. Bu, itu siapa, Bu? Cepet. Aku merasa lebih sehat. Sejarah mulai berubah. Masa depan telah selamat karena kalian telah menerima fortifikasi pangan. Wah, ibu-ibu komplek harus tahu ini. Pilih bahan makanan yang terfortifikasi itu penting buat masa depan.
Nasi yang kamu makan ternyata bisa ditambah lagi kandungan gizinya.
Mana bisa? Bisa dong.
Jadi gini, pada dasarnya beras sendiri sudah memiliki kandungan gizi seperti karbohidrat, protein, hingga zat besi yang manfaatnya sebagai sumber energi. Nah, berkat kemajuan teknologi, sekarang kandungan gizi beras bisa ditambah lagi dengan vitamin A, B1, B3, asam folat, hingga zinc yang manfaatnya bukan lagi sekedar sumber energi, tapi bisa mencegah kekurangan gizi yang menyebabkan stunting pada anak, mencegah kekurangan darah pengangkut oksigen penyebab anemia, hingga menjaga kekebalan tubuh agar tidak mudah terserang virus. Nah, proses penambahan gizi ini dikenal dengan nama fortifikasi pangan. Indonesia mulai menerapkan fortifikasi pangan pada produk garam di tahun 1980 dengan menambahkan yodium dalam rangka menanggulangi penyakit gondok. Dan hasilnya, prevalensi gondok turun dari 27% menjadi 9,8%.
Terus apa aja yang udah di
Fortifikasi. Saat ini yang diprioritaskan adalah kategori pangan wajib, mulai dari garam, tepung terigu, dan minyak goreng sawit.
Dari situ ya.
beras?
Sayangnya, beras yang merupakan jenis pangan pokok yang paling banyak dikonsumsi masyarakat belum difortifikasi secara merata. Dan kalaupun ada, harganya jauh lebih mahal dibanding beras biasa.
Solusinya?
Untuk itu, pentingnya fortifikasi pangan wajib masuk ke dalam program perlindungan sosial yang secara efektif akan fokus menyasar masyarakat rentan dan kurang mampu, sekaligus mencegah penyakit yang disebabkan oleh kekurangan gizi. Karena sejatinya, fortifikasi bukan sekedar menambah gizi, tapi jauh lebih besar dari itu, membangun generasi dan menentukan masa depan negeri ini.
Tapi jangan-jangan itunya yang di situ, Pak Aziz. Yang dicolokkan yang
Nasi yang kamu makan ternyata bisa ditambah lagi kandungan gizinya.
Mana bisa? Bisa dong.
Jadi gini, pada dasarnya beras sendiri sudah memiliki kandungan gizi seperti karbohidrat, protein, hingga zat besi yang manfaatnya sebagai sumber energi. Nah, berkat kemajuan teknologi, sekarang kandungan gizi beras bisa...
Iya, mati ini. Colokannya mati semua. Mati semua, speakernya mati, semua mati. Mati semuanya. Hidup.
Oh, orang itu.
Konslet lagi nih Pak.
Sirkuit ini. Sirkuit box.
Saya jadi takut nyoloknya Pak.
Mana yang mana?
Yang kabel keluar ini.
Iya. Nanti Pak ya.
Ya ya.
Jangan itu udah nggak boleh dipakai. Biar nama saya aja Pak. Biar Bapak.
Yang Bapak aja.
Jadi kalau itu program emang tugasnya dia. Kalau bapak itu kan tugasnya moderator.
Moderator enggak, bukan itu Pak. Nyoloknya ke situ. Iya. Itu dicabut nggak apa-apa.
Enggak sih Bu, harus. Enggak ngaruh harusnya. Mungkin emang lagi ini aja. Udah. Pak Haji coba cek.
Teh manis 1, 2, 3.
Teh manis.
Senyum kan?
Gimana, udah bisa dimulai? Oh, belum. Jam 3 ya Pak Haji ya? Jam 3. 5 menit. Oh, 5 menit lagi.
3 menit aja.
Oh ya udah. Ya.
Sudah ada berapa sih?
72.
Ada yang kita harapkan lagi
3.
Right. Assalamualaikum warahmatullahi wabarakatuh. Blessing to all of us. Good afternoon and good morning to our colleagues in Nigeria. Distinguished speakers and participants, welcome to today's seminar on the generation and the use of individual food consumption and micronutrient status data to support the development and evaluation of mandatory food fortification, drawing lessons from Indonesia and also Nigeria. This session aims to strengthen our understanding on how high quality individual level data can inform more precise evidence-based nutrition policies and improve program effectiveness. My name is Ajis Wengstanggang and I'm part of the Indonesian Food Fortification Foundation, KFI, as your moderator today. It is a pleasure to facilitate this session.
Saya percaya bahwa Indonesia Emas 2045 hanya dapat terwujud bila kita menyiapkan generasi yang bebas dari kekurangan gizi.
Saat ini sudah ada 3 komoditas yang sudah dilakukan secara wajib.
Fortifikasi pangan adalah investasi fundamental untuk membangun generasi Indonesia yang lebih sehat, cerdas, dan produktif.
Amanat yang penting buat bangsa kita, khususnya untuk memperbaiki gizi buat kelompok-kelompok yang rentan dan juga marginal.
KFI telah memberi kontribusi signifikan bagi program perbaikan gizi nasional. Forum ini telah menunjukkan hasil konkret. Di antaranya adalah menjembatani persoalan antara dunia industri dan regulasi pemerintah mengatasi kelangkaan bahan fortifikasi.
Kami memahami bahwa masalah kurang gizi mikro belum banyak mendapat perhatian, bahkan mungkin terabaikan meskipun program fortifikasi pangan telah dicanangkan sejak lama.
Indonesia masih menghadapi prevalensi kekurangan gizi mikro yang mengkhawatirkan. Berdasarkan survei kesehatan Indonesia SKI tahun 2023 mencapai 22,1%. Angka ini mengingatkan kita bahwa intervensi gizi berskala besar menjadi kebutuhan yang mendesak dan strategis. Dalam menghadapi tantangan tersebut, saya mendorong KFI untuk melakukan refleksi terhadap visi dan misinya.
Jadi masalah fortifikasi ini tentu perlu diadakan semacam evaluasi ya, supaya para pengusaha yakin bahwa fortifikasi ini ternyata bermanfaat.
Salah satu tantangan keberhasilan dan keberlanjutan program fortifikasi pangan adalah tersedianya data yang up to date.
Dengan sinergi pentahelix antara pemerintah, industri, akademisi, masyarakat sipil, dan mitra pembangunan, serta komitmen kuat untuk mengatasi tantangan yang ada, saya yakin Koalisi Fortifikasi Indonesia akan terus menjadi motor penggerak dalam mewujudkan Indonesia yang bebas dari masalah kekurangan gizi.
Ladies and gentlemen, today's program will feature 2 main presentations highlighting lessons learned from Indonesia and also Nigeria. Without further ado, I would like to invite Ms. Nina Sarjunani to deliver the opening remarks and officially open the webinar. Ibu Nina, the floor is yours.
Thank you. Professor Asnawi Abdullah, Head of the Health Development Policy Agency of the Ministry of Health of the Republic of Indonesia. Ms. Adegbite Olufunmilola, I'm very sorry for not pronouncing your name correctly. Director of Nutrition Department, Federal Ministry of Health and the Republic of Nigeria. along with her team, including Dr. Maria, Dr. Fatima, Dr. Helen, and Dr. Abata. Thank you very much for participating in this webinar. And Dr. Jonathan Gorstein, Senior Program Officer, Nutrition Program, Global Growth and Opportunity Gates Foundation. Mr. Rizwan Yusuf Ali, Global Partner Director for Technoserve. Ms. Dwi Puspasari, Acting Director of Center for Health Services Policy, Ministry of Health of the Republic of Indonesia, and representative from ministries and agencies who participate in this webinar, as well as representative from professional organization and industry associations, from development partners and civil society, as well as representative from universities and polytechnic in Indonesia. Assalamualaikum warahmatullahi wabarakatuh, and blessed for all of us. Very good afternoon, and of course very good morning for our distinguished colleague in Nigeria who are already joining this webinar. And first of all, I would like to express my sincere appreciation and gratitude to the organizers and partners for convening this important webinar. I also extend a warm welcome to all participants, particularly our colleague from Indonesia and Nigeria, as well as representatives from various institutions and organizations. It is indeed encouraging for us to witness such strong collaboration and shared commitment in addressing global nutrition challenges. Ladies and gentlemen, micronutrient deficiency, often referred as hidden hunger, remain a significant public health concern across the world, affecting more than 2 billion people, particularly in low and middle income countries. Despite notable progress in many areas of nutrition, deficiencies in essential vitamin and minerals such as vitamin A, iron, iodine, folate, vitamin B complex, and zinc. And we all understand that this deficiency is associated with increased morbidity, reduced productivity, and impaired cognitive development, as well as, of course, reduced national development outcomes. Therefore, the availability of accurate and reliable, as well as updated data becomes critical and critically important. Data on individual food consumption allows us to better understand dietary pattern, identify nutrient gaps, and pinpoint population at risks. At the same time, data on micronutrient status provides concrete evidence on magnitude and severity in deficiencies. Together, these data serve as a strong foundation for designing effective, targeted, and evidence-based nutrition policies and programs. In Indonesia, efforts to generate this data have been undertaken through several national surveys. Data on individual food consumption were first collected through the Total Diet Study in 2014, and this effort is planned to be continued in 2026 this year. Meanwhile, data on micronutrient status have been integrated into large-scale national surveys such as Basic Health Research Survey conducted in 2007, 2013, 2018, and most recently in 2023. However, it is important to note that consistent data collection has been limited, with anemia among pregnant women being one of the few indicators regularly monitored across surveys in Indonesia. Nevertheless, gaps remain, particularly in the availability of data on key micronutrients such as iodine and folate. In this regard, experiences from other countries provide valuable lessons. Nigeria, in particular, has made significant progress in generating comprehensive and integrated data on individual food consumption and micronutrient status through the National Food Consumption and Micronutrient Survey conducted in 2021. Through strong collaboration among government institutions, research organizations, and development partners, Nigeria has successfully produced evidence that informs the design, implementation, and evaluation of national nutrition policies and programs. One of the most cost-effective, scalable, and sustainable in reaching large segment of the population strategies to address micronutrient deficiencies is mandatory food fortification. In Indonesia, for example, we have implemented mandatory fortification of wheat flour with iron, zinc, folate, vitamin B1, B2, and vitamin A for fortification in palm cooking oil, and iodine in fortified salt. At present, the government of Indonesia has conducted voluntary rice fortification policy. Mandatory food fortification policies have been undertaken as well, we believe, in Nigeria. The mandatory food fortification policy in this regard demonstrates strong commitment from both governments to improve population nutrition status. However, the success of fortification program does not rely solely on the implementation. It also depends heavily on continuous monitoring and evaluation undertaking. This is where high quality data on food consumption and micronutrient status plays a crucial role, not only in informing program design, but also in assessing the impact, identifying gaps, and guiding necessary improvements. Distinguished participants, today's webinar provides a valuable platform for sharing experiences and lessons learned from both Nigeria and Indonesia. More importantly, it allows us to explore how data can effectively be generated, analyzed, and utilized to strengthen mandatory food fortification program. Through this exchange of experiences of our countries, we hope to gain practical insights, foster mutual learning, and identify opportunities for further collaboration. We also hope that this discussion will encourage stronger integration of data into policy-making processes, ensuring that our interventions are not only well-designed, but also responsive to the actual needs of the population. Before I conclude, I would like to once again thank all the speakers and participants for your presence and active engagement in our webinar. Your contribution are essential in making this webinar meaningful and impactful. With that, I wish you all a productive and insightful discussion, and it is my pleasure to officially open the webinar on using individual food consumption and micronutrient data for mandatory food fortification insights from Indonesia and Nigeria. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Ibu Nina, for your kind opening remark for this webinar. So, ladies and gentlemen, I would like to repeat once again the objective of this webinar is basically to enhance understanding and capacity among stakeholders on the importance of generating and utilizing individual dietary data and micronutrient status data in supporting evidence-based policy development. With that, I would like to kindly invite our first speaker, where Professor Asnawi Abdullah will be represented by Ibu Dwi Puspasari, MSc, as the acting head of the Center for Health Services Policy, Ministry of Health. She would like to talk about advancing individual food consumption and micronutrient data systems in Indonesia, policy and future implementation of the National Individual Food Consumption Survey. Ibu Puspa, the floor is yours to take for about 30 minutes, please.
Thank you. Thank you very much for moderator. Good afternoon, Bapak Ibu, the participants of webinar today. On behalf of Prof. Asnawi, Director General of the Health Policy Agency, I would like to apologize for his inability to attend today's webinar and express my gratitude for the opportunity to be presented in this important discussion. So today, I'm presenting the policy and future implementation of the National Individual Food Consumption Survey, or we call it KMI, the strategic evolution of Indonesia nutritional data and how we will shape the future of health policy. Can you share the screen?
Yes, we can see your slides.
Okay, next slide. Okay, next slide. Okay, so to understand where we are going, so we must look back to 2014. At that time, Indonesia lacked comprehensive individual consumption data that reflected the unique conditions across all our provinces. We were facing significant hurdles. Stunting affected over 35% of our children, and adult obesity was climbing past 21%. Driven by global MDG targets and national laws like Law Number 18 of 2012 on food, our mission became clear. We had to ensure every Indonesian had access to safe, high quality, and nutritional balanced food. Next slide. To respond to those unique situations, we launched the Total Diet Study in 2014-2015. This was a landmark effort that combined the individual food consumption survey, or FKMI, with a food chemical contaminant analysis. For the first time, we could see not just what people were eating at national and provincial level, but also the adequacy of their macro and micronutrients intake, and any risk from chemical contaminants like pesticides or heavy metal. Next slide. So what did the 2014 FKMI reveal? It was a massive undertaking covering over 46,000 households and 41 individuals. The findings were a wake-up call that nearly 46% of our population had very low energy adequacy, and fruit and vegetable consumption remained alarming low, just 33.5 gram and 57.1 gram per day. While we saw the overconsumption of fats and sodium, highlighting a double burden of malnutrition. Next slide. So parallel to consumption, the 2015 food chemical contaminant analysis looked at food safety across 15 provinces. While food additives like saccharin and benzoate remain within safe standards, we found that concerning data regarding the lead exposure, which might be pose a risk to IQ development. Furthermore, exposure to magnesium, sodium, and iodine had already exceeded permissibly limits across all age groups. Next slide. Data is only valuable if it is used. The FKMI 2014 results have been the backbone for several ministries. The Ministry of Agriculture used it for the regional food planning. Bappenas utilized it for SDGs indicators, and the Ministry of Health applied it to evaluate specific nutrition programs and regulate sugar, salt, and fat, or we call it GGL. It is even reached global scale, contributing to projects with the WHO and FAO. Next slide. As we look toward 2029, so our goals are even more ambitious. We are committed to the SDGs, Zero Hunger, and the 2022 ASEAN Leader Declaration. Our national target is to reduce stunting to 14.2%. It requires a new wave of data to evaluate modern programs such as the pre-nutritious meal or MDG program, mandatory food fortification, and health nutrition initiatives to combat stunting. Next slide. This brings us to our next major step, the 2026 Nutrition Survey. This is a massive integrated design combining anthropometry, individual consumption, and a specific study on the free nutritious meal or MDG program. We will reach 345,000 households for stunting data and 81,000 households for the biomedical and consumption data. Using 24-hour results and blood or urine samples across 38 provinces, we will finally have a clear picture of the impact of our current intervention. Next slide. So this project of this scale requires a whole government approach. The steering committee includes the Vice Presidential Secretariat, Bappenas, and the Ministry of Health, alongside partners like the World Health Organization and UNICEF, and with the technical team comprising BPS and the National Nutrition Agency. We are ensuring that the data we collect is accurate, transparent, and ready to guide Indonesia toward a healthier future. This is my end of the slide. So thank you very much for your kind attention, and happy to have a discussion later on. So I give back to the moderator.
Thank you very much, Ibu Puspa, for your very informative presentations. We've seen how the Indonesian government tries to, monitor the development of the nutritional status of Indonesian people. We see from the Basic Health Research 2013, Individual Food Consumption Survey 2014, and then we're planning this year to have this Individual Food Consumption Survey 2014. And I believe from your presentations there will be questions coming from the floor, but I would like to remind our ladies and gentlemen that you can just write down the questions that you would like to ask, and of course, please, to whom are you addressing the question? Please write down your name, the institution where you come from, and then the question to whom, and then your detailed question. Okay, good. So we are going to continue our presentations in here, and we're moving forward with the second speaker that will be delivered by Ms. Adegbite Olufunmilola, the Director of Nutrition Department, Federal Ministry of Health, Nigeria. She would like to talk about strengthening evidence-based food fortification policies and program, lessons learned from Nigeria's 2021 National Food Consumption and Micronutrient Survey, NFCMS. So, Ms. Adegbite, the floor is yours. It's about 30 minutes, please.
Siapa? Namanya siapa sih?
Miss Adegbite?
Adegbite.
Can you hear us?
Barusan masuk kan? Enggak.
Lepas dia.
Alright, while waiting for her, I think we can roll up once again the video.
Nggak ada ya.
Ada suara
Lagi.
ada timnya. Nanti masuk situ kan.
Bumper video aja mas, bumper video dulu.
Ya.
Nasi yang kamu makan ternyata bisa ditambah lagi kandungan gizinya.
Mana bisa?
Bisa dong. Jadi gini, pada dasarnya beras sendiri sudah memiliki kandungan gizi seperti karbohidrat, protein, hingga zat besi yang manfaatnya sebagai sumber energi. Nah, berkat kemajuan teknologi, sekarang kandungan gizi beras bisa ditambah lagi dengan vitamin A, B1, B3, asam folat, hingga zinc. Yang manfaatnya bukan lagi sekedar sumber energi, tapi bisa mencegah kekurangan gizi yang menyebabkan stunting pada anak, mencegah kekurangan darah pengangkut oksigen penyebab anemia, hingga menjaga kekebalan tubuh agar tidak mudah terserang virus. Nah, proses penambahan gizi ini dikenal dengan nama fortifikasi pangan. Indonesia mulai menerapkan fortifikasi pangan pada produk garam di tahun 1980 dengan menambahkan yodium dalam rangka menanggulangi penyakit gondok. Dan hasilnya, prevalensi gondok turun dari 27% menjadi 9,8%.
Terus apa aja yang udah di
fortifikasi? Saat ini yang diprioritaskan adalah kategori pangan wajib, mulai dari garam, tepung terigu, dan minyak goreng sawit.
Lah, beras?
Sayangnya, beras yang merupakan jenis pangan pokok yang paling banyak dikonsumsi masyarakat belum difortifikasi secara merata. Dan kalaupun ada, harganya jauh lebih mahal dibanding beras biasa.
Solusinya?
Untuk itu, pentingnya fortifikasi pangan wajib masuk ke dalam program perlindungan sosial yang secara efektif akan fokus menyasar masyarakat rentan dan kurang mampu, sekaligus mencegah penyakit yang disebabkan oleh kekurangan gizi. Karena sejatinya, fortifikasi bukan sekedar menambah gizi, tapi jauh lebih besar dari itu, membangun generasi dan menentukan masa depan negeri ini.
Bayangkan, 1 dari 3 anak Indonesia berisiko mengalami stunting. Itu berarti masa depan mereka terancam hanya karena kekurangan gizi. Anemia, stunting, dan kekurangan vitamin A adalah ancaman nyata bagi masyarakat kita. Kekurangan gizi ini seperti piring kosong. Tanpa zat gizi yang cukup, tubuh dan pikiran mereka tidak bisa berkembang optimal. Stunting memengaruhi pertumbuhan fisik dan kecerdasan anak. Anemia menyerang produktivitas ibu hamil dan juga remaja. Kekurangan vitamin A.
Ajis.
Hello, good morning.
Hello. Good morning.
Yeah.
Miss Adek Bite. Can you please
Good morning.
Yes, good morning. Can you please try to switch off all the device instead of your device within that room because the sound is echoing. Can you hear us? Hello? Your sound sounds pretty far from the device. No, it's not clear. Can you move closer to your device? Yes. To the microphone, probably. Bisa Peter? Miss Adek Peter, can you hear us? Or probably Miss Maria or Miss Helen can help us? Hello?
Hello, good morning.
Yes. Who is speaking? Sorry, Miss Maria or
This is Dr. Helen.
Dr. Helen? Yes. Please, Dr. Helen, would you like to represent Miss Adek Bita or Adek Bita alone will present this presentation?
She will be the one to present it, please. But we are not in the same environment right now. So maybe she's having a bit of difficulty where she is. But let's just be patient, please.
Yes, we'll be waiting for her.
Yeah, thank you very much.
You're welcome.
Nggak usah nyalain kamera dia.
Good morning, all. Hello, can you hear me?
Yes, we can hear you. Miss Adik Bitte, can you please
So
just
sorry
switch?
for the little disruption. Good morning, colleagues.
Yes.
I want to apologize for the little delay. I think it's my system. Yeah, so I'm on the phone now.
Yes, you're good to
Yeah,
go.
good morning. I want to thank you for the privilege to be on this call this morning. I shall be talking on strengthening evidence-based food fortification policies and programs. Lesson learned from the Nigerian 2021 National Food Consumption and Micronutrient Survey. So, can the slide move on? Hello? Can I have the next slide?
Next slide.
I think. Are you going to slideshow by yourself or through our administrator? I think it's supposed to be Ibu Maria or Ibu Helen. Okay. So, just slideshow me.
Oh, belum muncul ya?
Cuman kenapa tadi
Oh, nggak muncul.
Okay, we're showing your slide now, Miss.
Baru nih.
Okay, thank you so much. So the introduction in 2021, Nigeria had the National Food Consumption and Micronutrient Survey, which is a cross-sectional population-based survey with an objective to have to assess the micronutrient status, the anthropometry and diet intake of women of reproductive age, women 15 to 49 years, including pregnant and lactating mothers, children 6 to 59 months, as well as the micronutrient status of non-pregnant and adolescent girls, that's ages 10 to 14, and identify key factors associated with poor nutrition in this population. If you look at this side, you will see the picture of the back cover. You see the picture of the back cover of the National Food Consumption and Micronutrient Survey 2021. Can I have the next slide? Can I have the next slide, please?
It's already on the next slide. Probably.
Can I have the next slide? The slideshow is not working on the phone.
It's probably your connection with other feature. Because in our screen it's already changed. Yes, to the second slide. Can you see it now?
Yeah. the Federal Ministry of Health, Federal Ministry of Budget, and Federal Ministry of Agriculture and Food Supply, in collaboration with the developmental partners engaged in with the IITA, as they lead the implementation of the National Food Consumption and the Micronutrient Survey. This was conducted to address data gaps in micronutrient status and dietary intake, and this was also to support evidence-based policy making, as well as large-scale food fortification to align with global nutrition targets. Yeah, so if we look at the survey, the 2021 survey, it's targeted women of non-pregnant women of reproductive ages 15 to 49 years. It targeted women 15 to 49 years, as well as non-pregnant adolescent girls 10 to 14 years. And the survey covers the South-South, which is colored, the Southeast, which is colored in lines, the South-South, which is colored in blue, the Southwest, which is colored in pink, the North Central, Northeast, and Northwest. And what were the key things that was done? The micronutrient biomarker and anthropometric measures was the measurement and the strategy used for these different ages. The dietary intake biomarker was also taken for all these groups, except for the non-pregnant adolescent women of ages 10 to 14 years. Yeah, and the National Food Consumption Micronutrient Survey is a population-based survey which was done in a cross-sectional, as a cross-sectional survey. So can we have the next slide? Yeah. So the Index 24 mobile app was used for the 2021 National Food Consumption and Micronutrient Survey. And I want to say that Nigeria is the first country that used this mobile app on a large scale basis, where we had 14,000 plus respondents providing their responses on this data mobile app. And this was used to collect a quantitative data on the 24-hour dietary record, which is a significant advantage for the individual level of dietary consumption assessment. This was developed by the University of Tufts and is part of what was used for the consumption of this data. So can I have the next slide? This thing is not charging. Yeah, so these are the supporting countries. These are the supporting bodies. Federal Ministry of Health, Federal Ministry of Agriculture, Budget and Economic Planning, Bill and Melinda Gates supported, GAIN, IITA, World Bank, UNICEF, and USAID. Next. Yeah, so the micronutrient survey was supported by laboratories, validated by the Centers for Disease Control. Even though CDC did not work with us to the end of the survey, but they were able to give us laboratories that helped us to analyze different biomarkers based on the ISO standard. We have the National Biomarker Laboratory that analyzed B1 and B2. VITS Main Laboratory in Germany analyzed for us the ferritin, retinol binding protein, and ferrous terifin. Vitamin A Assessment Laboratory was able to assess the retinol, including MLDR. Peking University Laboratory in China supported in analyzing iodine, serum, folate, zinc, vitamin B12. While Sin Lab was able to support in analyzing hemoglobin, genotype, and HbA1c. Yeah, so exploring effective food fortification strategies in Nigeria. These are the food that are already fortified and they are under mandatory fortification. We have vegetable oil, flour, salt, sugars, and semolina. Presently, we are moving forward.
Hello, Miss Adik Bite, are you still online? Hello?
Baru gabung lagi.
Lepas tadi, lepas.
Hello, I think she might be having a problem with network.
All right.
Yes.
Can you hear me?
Yes, crystal clear. Please go on.
Yeah, so for these are different food vehicles used among household, sampled among non-pregnant women, and we see that the consumption for the colors, we see the consumed food in blue, the purchased food in orange, the branded foods in ash, the food labeled as fortified in yellow, while we have fortified food in any amount in blue. For the blue color, which is picked for vegetable oil, we see that vegetable oil is highly consumed and is food that is highly purchased. When we go to sugar, sugar is highly consumed, is highly purchased, and lots of people take branded sugar. If we go to salt, salt is highly consumed, is highly purchased, and people take different branded salt. For bouillon, we will see that virtually all of them are picked. For bouillon, the blue color shows the highly consumed bouillon for Nigeria, and we could see that 98.5% of Nigerians consume bouillon, 99.2% of Nigeria consume salt, and 90.3% of Nigerians consumed oil. So when you look at the purchase, there's high purchase, 97.5% purchase of bouillon, and that is why in Nigeria we are trying to move towards mandatory fortification of bouillon. For salt, is already fortified with iron. For sugar, is already fortified, and for most of the vegetable oils, they are already fortified. They are already fortified with vitamin A. So consumption of fortified food vehicles is where Nigeria is proceeding to. Yeah, can I have the next slide? Next slide, please. Yeah, thank you so much. for the next slide, we could see the current status of food fortification policies in Nigeria. An overview of existing policies affecting food fortification. We have a food dietary guideline, which we are working on presently to update. We have the 2010 version, but we are updating presently. The National Social Behavioral Strategy have recently been updated. The Micronutrient Deficiency and Control Guideline is also being updated. So insight from the National Food Consumption and Micronutrient Survey shows that stunting remains 33.8%, wasting remains at 11.5%, and underweight is 22.5%. Over. Can we go to the next slide? Yeah, so here we have the consequences of deficiency on the population. If we look at the trend there, between 2018 NDHS and 2024 NDHS, we could see that there's increase in stunting in 2024 NDHS. The initial stunting rate we looked at was in the micronutrient survey. But in 2018, we had 40% for stunting. In 2018, we have 37% for stunting, and 2024 NDHS, we have 40% for stunting. Wasting also increased from 7% to 8%. Underweight increased from 22% to 27%, while overweight reduced to 1% from 2%. Yeah. So this is the recommendation for policy improvement in the fortification. 1, it's to encourage private sector partnership. And in our policy formulations, we have involvement of a lot of private sector partnership, especially the manufacturers and the private industries are involved. We have different levels of engagement with them in our nutrient profile model development and other food-related policies. Also, to accelerate availability of fortified food in the market, we work with the NFA and the Sun Business Network. Also, we strengthen regulatory framework for fortification, working with NAFDAC, which is the regulatory body, SON, which ensures standard, and FCCPC. We also do a lot of monitoring and evaluation for mechanism for fortification, establishing robust system to assess the impact on public health on the public health impact. Another aspect is integrating fortification into national strategies, and a lot of strategies are being developed integrating fortification into the national strategy. Next slide. Yeah, the next slide speaks about the impact of micronutrient deficiency on health. If we look at the key findings, we see that micronutrient deficiency affects the lifestyle of people all through. It causes a lot of health implication, up to 50% of health implication. It has impact on child growth. It also creates nutritional gaps, and it helps for policy recommendations. Yeah, so this is evaluation of public health impact on food policies. Can we move? Yeah, so we're looking at the roles of shaping food policies. One is collaborative approach in food fortification. Like I said earlier, we partner with other stakeholders. We are in the nutrition specific platform. We partner with nutrition sensitive platforms. We partner with the National Fortification Alliance, which are private bodies coordinating private bodies that coordinate the industries and the companies who work on food fortification as well as the Sun Business Network. We strengthen strategies for effective policy, and these are some of the policies we have looked at. We also do evidence-based decision making, ensuring our decisions are data-driven. You know, next slide, please. Yeah, so these are the lessons learned from the Nigerian food fortification effort. One is challenges faced with food fortification. We identify barriers to successful implementation of fortification initiative, you know, and we are planning for future opportunities to do better. Yeah, so another one is the survey provided insights into nutrient deficiencies and the effectiveness of existing fortification programs. So now we are moving towards fortifying rice and other commodities like wheat and bullion. Yeah, as part of our success stories is examining successes in case studies, which is offering guidance for scaling up large-scale food fortification, bullion fortification. Biofortification is what the agri sector work on. They do biofortification of cassava, biofortification of rice, and other items. Yeah, rice fortification, we're increasing awareness on rice fortification. Presently, we have 11 companies in Nigeria that have fortified rice for the IDP camps and other special places like school feeding. Also creating public awareness. Yeah, so one of the lessons learned is that we have been able to create public awareness. For example, on sodium reduction, it was observed that Nigerians consume too much of salt from the survey, and in our urine, iodine is being found, which is used to fortify salt. So we could see a lot of public awareness going on, social behavioral change communications, and a lot of collaboration to increase large food scale fortification in Nigeria. Next. Yeah, so what are the further directions for micronutrient intervention? One is innovative approaches to food fortification. We are exploring technologies and methods towards improved food fortification in Nigeria. I was in a meeting yesterday where they were talking about electronic platforms that they use to follow up with the companies on food fortification, to follow up with the quality of the premix, they follow up with the quality of the micronutrients they are using to fortify, and they ensure quality through the entire process. So there are a lot of innovations, and there's an integration of fortification with existing program so that we can maximize the impact and do resource utilization and control. Also, monitoring and evaluation framework is being strengthened towards food fortification, as well as engagement of community in this nutrition initiative. This cannot be done without the community because they are the consumers, they are the end beneficiaries. So we do all to ensure that the communities are involved and they are educated and they accept the fortified, micronutrient fortified food. They see the reason to use it and they accept it. Next slide, please. Yeah, thank you. So this is food fortification policy impact. The Impact shows that it has impact in public health outcomes. 95% impact in public health outcomes.
Ada.
Ada cuma suaranya. Ada cuma suaranya.
Dia mute. Enggak.
Sinyal.
Alright. The connection is lost again. We just wait because I believe this is the last slide of her. Hello, Miss Adik Bita.
Can you hear me?
Yes, you can continue, please.
Yeah, so it has very high public health impact, 95%. The food qualification policy, the impact also has program monitoring, which is 85%. For policy implementation is 90%. A lot of policies have been implemented from the outcome of the survey. Stakeholders' engagement has improved by the reason of the survey and the nutrient awareness. The nutrient awareness has increased, even though we need to do more on the awareness. Can we move on? Yeah, so this is to say thank you, Terima Kashi. Sorry for the network issues. I want to say big sorry. Our network in the ministry today doesn't look very friendly, but please thank you for following through. Thank you for your patience. I appreciate you. Over.
Thank you very much, Ms. Adik Bita, for your very informative presentation as well. So in total, we have already 2 presentations, and I would like to open the floor for the discussion. I tried to monitor our chat room, but it seems that nobody has put some question down there. So let me try to ask some questions, especially to Ibu Puspa and also Ms. Adik Bita. For Ibu Puspa, we know that Riskesdas was conducted in 2013 and followed by SKME in 2014, and another SKME was planned for this 2026. Could you kindly elaborate on the rationale for this timeline, particularly the considerations behind conducting SKME again within a relatively short interval, very long interval? In addition, could you also share whether the strategy plan for this 2026 SKME will follow a similar approach to the 2014 survey, or there will be any significant methodological or design changes? And we believe that KFI already also made some studies and giving some recommendations, especially for this 2026 SKMI. That's the first question to Ibu Puspa. And the question for Ms. Adik Bita will be, could you please clarify whether this 2021 NFCMS represents the very first survey of its kind in Nigeria, or if it's part of a series of surveys conducted over time? Additionally, may I know how frequently Nigeria plans or intends to carry out NFCMS moving forward? That's the first question. And my second question is, what is the main finding of this NFCMS 2021 that you can use for real policy development in Nigeria, especially when you say previously that you would like to combat stunting, anemia, and also wasting as well? Thank you. I would like to give the opportunity first to Ibu Puspa.
Okay, thank you very much. I just remind me if any other question is not responded later on. So I will respond for the first, the last question of your as you mentioned. The first time about the 2026 design for SKMI,
So SKMI, Indonesia National Nutrition Survey. So it will compromise three surveys. One is SSGI, is nutritional status for under 5, and the second one, as I mentioned, the SKMI, and with the survey for the free nutrition status from the MBG program. So for the methodology, as I presented earlier, that is a cross-sectional. It's same like 2000. It's same with the conducted the survey from SSGI since 2021 until 2020. The difference of the instruments, it will be, there is a questionnaire developed for the 3 surveys, and there might be the enumerators also will be different. So the 2 teams for the enumerators will be
Puspa, sorry, you are lagging.
So the
Ibu Puspa, can you hear us?
So this the PS previously in 2000 the will be collected with methodology for the same.
Miss Adek Bite. Hello, Ibu Puspa, are you there?
Yes.
Okay.
Yes, sorry, I lost some connection.
Yes. Could you
So
please repeat once again?
yeah. So for the methodology, it's the same like the nutritional status methodology, cross-sectional, and the sampling frame is different because BPS is changing the sampling frame for a survey 2025 and 2026. They are using the approach of the very what is that SLS. Previously is a block census. Now it's based on the what is that the sub-district level. So in kecamatan or kelurahan they are using the sampling frame based on the kelurahan and kecamatan. So that's what is the difference in this survey for 2026. The instruments also we developed more simpler and using also the digitalized technology, and we developed ourselves the platform for using the with our own apps, and we also already developed the KPIs, so FC. Management team, and this survey will conduct might be with the will be collaborative with other partners. So this will still in discussion with the steering committee.
Right.
I think that's my explanation, or to explain further on. the 2026 survey.
Just
So
a
is
quick
there any?
question, Bu Puspa. In 2026, what's the number of the samples? Because in 2014, and considering it's like more than 10 years already, what's the number of the samples? Because in 2014, I've seen from your presentations around 160,000, more than 160,000, and the biomarkers as well.
Yeah, in my
And
presentation
sorry,
already.
what's the total number for the samples and the biomarkers? And do you think the results of this measurement can be actually taken to develop the policies in the near future?
Yes, we've been discussed with the experts with the sample numbers here will be the reference for the
Policymakers. So 81,000 households for SKMI is at the provincial level. So 3,045,000 for the stunting and or nutritional status. It's a representative for the district or municipalities level. So this is already discussed with some expert what is the policy impact for the design. So it's still it can be a reference for other ministers. Other difference from the 2014, it's just on the national level. So yeah, some of the at the time is the budget constraint. So we tried to do the 2026 for SKMI and biomarker of the at the provincial level.
So how many biomarkers are we going to conduct? I mean, the evaluation?
So far, we in our planning is 8 biomarker. It depends on also the budget that we will allocate. I mean, like it's not our, we will allocate it because at this time the BGN will allocate this budget for the survey. So we propose 8 biomarker.
And the last question is basically, do you think that based on these sample collections, the results later on being obtained, do you think that we can utilize the information coming from here for the near future policy development, especially when we talk about, you know, leveraging nutritional status in Indonesia?
Yeah, we expect to do so, and this is that we will what is that? This is our expectation that this survey will be utilized for many policy recommendations in the future, because as we observe and we saw that this nutritional status and also micronutrient survey will be updated, might be in the future. It's not only doing by survey, and we can collect this the data by using the digital. So some of the literature mentioned that population-based data can be collected by using the nutrition application that now we have. So for the future, we've been discussed to collect the data population base is not from the survey. So we are still on in discussion with many industries how to collect the data in the future without doing the survey, because it's costly for Indonesia at this time.
Okay, thank you, Ibu Puspa. I would like to move forward with Ms. Adik Bite. You answer actually in the chat room, it's 1968, 2001, 2021. Are you still there, Ibu Adik Bite? Can you hear us?
Yes.
Thank you. You're still there. Okay, good. So it seems.
Good day.
So it seems.
Morning.
Hi. Yeah. So it seems that it's not really in a sequential pattern, yeah. 68, 2001, and 2021. Let's just talk about 2021. I believe,
Yes.
from
Yes.
2021 with these 14,000 more samples, you can of course get some results. And then I would like to ask, what are the real policy developments being done based on 2021 results that you develop and still accommodating until to this day?
Yeah, we have done the sodium reduction policy. We have done the sodium reduction policy because Nigerians consume too much of salt. We are working on the nutrient profile modeling. The nutrient profile model guideline, national guideline on nutrient profile model, speak to reducing the sodium or salt intake, reducing sugar content or non-sugar sweeteners, and reducing trans fats. And these are part of the fallout of the survey. We are also working on development of social behavioral change communication guideline towards enhancing the population to know about fortification. Number 4, we are working on, we have a document being developed on food fortification, updating and reviewing the previous documents. So the MNDC guideline, which also expired, micronutrient deficiency control, micronutrient deficiency and control guideline, we are also reviewing it. Then the NSPAN, we are also reviewing it. So these are some of the fallout we got from the survey, the nutrient, the food consumption survey, which depicted some things that needed to be amended. So we have about 6 different documents speaking to the outcome and the results we got from the survey. Yeah.
Right. Thank you very much. I would like to continue the question coming from Ibu Dr. Elvina Karyadi from the World Bank, addressing to the, conveyed to Ms. Adik Vite. I would like to read the question. Considering the trends observed in the 2018 and 2024 surveys in Nigeria, which show an increase in stunting prevalence and ongoing challenges, can the findings from micronutrient status surveys explain this upward trend? Furthermore, what policies or interventions have been implemented based on the survey results to address the rise in stunting?
Yeah, on the World Bank issue, I want to say that the World Bank have been supporting us to address stunting and issues of maternal, neonatal, infant, young child nutrition. They have been supporting us. We concluded the ARIN 1.0, and presently we're about to activate ARIN 2.0. ARIN 2.0 is taking up 30th of April, that's this month. A lot of procurement plans are in place, trainings, social mobilization and other activities, capacity building towards the ARIN. So World Bank has supported Nigeria with a subsidiary loan, and this is being given to 21 states as a subsidiary grant. And this is to support the maternal, the women, the infant, and the young child. A lot of things are being procured towards reduction of stunting. We have the SQLNS. MMS is already being supplied through the state and through other bodies. The state government of Nigeria, we have 37 states in Nigeria. The governors of each state are putting in the Child Nutrition Fund, which they are using to buy MMS. And UNICEF is doubling up this money to ensure that if they put in 50 million naira, UNICEF give them procurement of MMS, SQLNS, and other nutrition commodities for 100 million naira. So there's a doubling. And like I said, Army is giving us SQLNS, they are giving us MMP, micronutrient powder, they're giving us Resoma, they're giving us F100, F75, and other commodities just to reduce stunting in Nigeria. So I want to say that the World Bank is contributing greatly to reducing stunting and micronutrient deficiencies, as well as overall malnutrition in Nigeria. So we're kicking off 30th of April, and I know our indices from this year gets better because the government is committed not only at the state level but at the national level. Partners are getting more committed to address issues of stunting in Nigeria. Thank you.
Right. I would like to see again from different perspective what is being asked by Ibu Elvina. Since we know that NFCMS being carried out in 2021, but what we've seen also the trend of stunting increasing in between 2018 and 2024. So what was actually being taken into consideration after the survey 2021 that is used to combat stunting, but in fact it turns out that in 2024 the stunting number increased. Can you still hear us, Ms. Adik Bite? All right. While waiting for her, I would like to ask open the floor. If you do have questions, you can also open your microphone and then ask directly here. Ibu Puspa, we have been available. Anyway, Ibu Puspa is the acting head of the Center for Health Services Policy, Ministry of Health. If you do have questions, you can just give some emote to raise your hand, and then you can ask questions directly. Okay, Ibu Maria Ode Bisong, please. Miss Maria, please. Gone as well. All right, Ibu Puspa. I would like to ask a question regarding this SKMI 2026. Ibu Puspa, are you still with us? Ibu Puspa, are you still with us?
Yes.
Okay. When do you think the implementation of this SKMI 2026, since we know now almost in the midst of the year? Do you have some information for us regarding the implementation of this survey, please?
So we are still waiting for the budget allocation from the DGN to execute when can be released. So we expect on June
they will give us the decision. The budget will be released, and we can do the survey 2026, or we have to postpone to the next year.
Thank you very much. So it means all the preparations not yet started because the budget is not yet transferred to, I mean, it's not released yet to the account.
We've been done. Just only the implementation is not yet. The preparation we've been done. We already have the guidelines. We prepared for the digitalization of the survey, and then we've been discussed with the BPS, the plan of analysis, and the implementation is started not yet because we have to train the enumerators and other things. So, but all the preparation previously that we have been conducted the discussion with the experts, we've been done since 2 years ago, 2024, 25, and 26. This is we already getting ready on January at that time. And also we prepared also if this survey conducted by the third party like the previous one, we've been discussed also with the PGN and also the Bappenas at that time. So we've been prepared all, and just only the budget execution from the Bappenas and PGN as soon as they are revealed, so we can just directly conduct the survey. We've been discussed that if the June the budget is not revealed, so we have to postpone to next year because there will be some constraint on the from our side to conduct massive training for enumerators, and also we have to do the updating for the household, and after that we have to conduct the survey within 2 months, and after that for analysis the data also will take some time, and to do the analysis of biomarker also need to prioritize which one will be revealed on the report, and the others should be next year on the second phase of the report, because biomarker also for the proposed 8 biomarker also will take time, and we've been identified which lab can be as our lab for analysis this biomarker. So that's preparation already done. Just only to the execution of the budget, we still waiting for the Bappenas and PGN.
Right. Thank you very much for the information, Ibu Puspa. I would like to move to Ibu Adik Bite.
Yes.
Miss Adik Bite, would you like to continue?
Yes, I'm here. Yeah.
Please.
I'm with him.
Yeah. Okay. I would like to once again ask from a different perspective, because the question is basically, NFCMS happens in 2021, but the trend of the stunting 28 to 2024 was actually increasing. So what was actually being taken into consideration in the survey 2021 to be carried out to combat the stunting? But the fact turned out that the stunting was actually increasing in 2024.
Yeah, a lot of factors were actually considered from the results of the stunting in the National Food Consumption and Micronutrient Survey. This includes a lot of partners' engagements and planning to crush malnutrition and stunting in Nigeria. There were a lot of intervention in place. The wife of the president of the country has gone ahead to create a national community food bank. A national community food bank. The National Community Food Bank is to help pregnant women, help lactating mothers, children less than 6 years, and even adolescents to eat healthy. There's plan for them to be given coupon to have access to food on bi-weekly basis, which helps them to live better. Then we are also working with the Ministry of Agri on biofortification, such that every plant that is being planted in Nigeria has some level of fortification with B9, B2, B1, zinc, iron, and other fortificants. So at the same time, a lot of support from partners and from government has been established. Just like I said that the state governments are now committed. The federal government have written to them officially through UNICEF, and they are fully committed to ensure that micronutrient is available for every pregnant woman. MMS is available, SQLNS is available for every child 6 to 23 months. Also to make sure that where SQLNS is not available, the child has access to MMP, micronutrient powder. So for children who are in places where we have high security issues, who are in IDP camps and they have come back with severe acute malnutrition, we have enough procurement of Resomal, F75, F100, RUTF to take care of these cases. So a lot of partners are also committed in the high-risk states. We have 5 highest-risk states in the all in the northern Nigeria. And we have a lot of partners supporting such states. Community sensitization is ongoing. Community education and engagement is ongoing. Counseling of mothers that come for other interventions, nutrition counseling is ongoing at our health facilities. Commodities are available at the health facilities. So I believe that with all those interventions in place, Nigeria will be able to combat and quash the high stunting in Nigeria. Thank you, and over.
Right. Thank you very much. I would like to give the opportunity to Ibu Nina if you would like to ask questions, please.
Thank you very much for the insightful presentations of Indonesia and Nigeria. We learned a lot how difficult it is to collect the data, especially for collecting some important biomarkers in Nigeria. I would like to ask how the Nigerian government overcome the challenges in collecting the biomarker from the sample. Is it difficult to get the informed consent from the respondent? And because it is, I think that is the biggest challenge, right? To get approval from the respondent that this survey will take biomarkers from each of the respondents. Thank you.
Yeah, thank you so much. Just to inform you that I resumed to nutrition office January this year, first day of January. So I will want to call on someone who participated in the survey, Dr. Maria, to please respond to that question. She was part of the survey and she understood it all. Maria, can you come on board?
Okay, thank you, Ma, for giving me the opportunity. I hope you can hear me. Hello?
Yes.
Hello, can you hear me?
Hello?
Yes, we can. We can.
Okay. Yes. So I was actually the desk officer for the survey, and at the time, the survey is multi-sectorial. A lot of stakeholders were involved, and so we worked with the National Population Commission, we worked with the National Bureau of Statistics, and like the National Population Commission and National Bureau of Statistics are very conversant with survey at population level. So we, before going to tag the houses and count the number of households and respondents, we did what they called the pre-planning meetings and the community entry, whereby you have to work with the community, the gatekeepers, sensitize them and let them know what the survey is after getting your right approval from the appropriate authorities, and letting them know the kind of samples you're collecting from them and the effect of the samples, the no side effects and all that. So once they are well sensitized and the respondents have been selected randomly, knowing the cross-sectional survey, that makes it very easy for them. And we also have their consent. Already they are well sensitized. We also have both written and verbal consent that was taken from them. So majority of them cooperated to collect samples. But we also had some issues with cultural barriers and communication with some of the respondents. That was handled using the community platform. So we had minimal mistakes on that. Over.
All right.
Thank you, Mariam.
Thank you. Ibu, any additional question?
Yes.
Please.
My next question is addressed to Ibu Puspa. I'm wondering whether you could share with us the 8 biomarkers that you planned in the next survey. Are the biomarkers similar with the biomarkers collected in the 2014 dietary intake survey? 2014 ada biomarker. Okay. In 2020, okay, in 2026 or 2027, it is planned that there will be 8 biomarkers collected, right? Could you share with us what are the plan?
So I think it's vitamin A, retinol, and but maybe my colleague there already. And can you just
This is still in Indonesia, so iodine, hemoglobin, vitamin A is retinol, ferritin, transferrin, vitamin D, B12, and also folic acid. So this is the biomarker that we will collect in the field.
Iodium, hemoglobin, vitamin A, ferritin, folic acid,
di sana mah ngelihat, ini buat yang di YouTube.
B12 and vitamin D.
Kalau apa ini ngelihat.
Thank you very much.
Right. So I would like to move forward with the question coming from Ibu Ning Pribadi, addressed to Miss Adek Bitte. You mentioned about phasing out the consumption of bulk oil for increasing the effectiveness of edible oil fortification. What kind of intervention that has been implemented for that?
Can you come again?
Yes, you mentioned about phasing out the consumption of bulk oil for increasing the effectiveness of edible oil fortification. What kind of intervention that has been implemented for that, for the for the phasing out of bulk oil into the edible oil fortification?
Yeah, we are not phasing off the bulk oil. What we are doing is ensuring that our oil is fortified with vitamin A. We're ensuring every oil that is being used in Nigeria is fortified with vitamin A. Yeah.
Okay. Well, basically the question is if you would like to minimize the bulk oil consumption and you would like to improve edible oil fortification, can you please mention
what interventions
have been carrying out by the government of Nigeria to do this?
Yeah, edible oils. We have about 6 different edible oils that have been fortified in Nigeria, and those are the main oil that are being consumed. We have the sonola oil. We have other oils which are edible oils. These have been fortified, and we are doing more fortifications, you know, in other edible oils. And like I said, we have a platform that we are using to collect data to see that the fortificant is ideal, to see that the fortificant is ideal, is a quality fortificant, to see that the premix use is also quality. So, and that is what NAFDAC and FCCPC as well as SON is doing to ensure standard in fortification of edible oil. Yeah, thank you.
Yeah, right. Thank you very much. Another thing, Ms. Adikbite, you said that based on 2021 survey, you actually be able to produce what's so-called salt reduction policy. That's the first thing.
Yes.
And the second thing
Yes.
is national nutrition proven model guidelines, right?
Nutrient profile model. Nutrient profile model.
Nutrient profile model guidelines, right?
Model. Yes, yes.
Okay.
Nutrient
So,
profile.
this nutrient
So,
profile
a lot
model, is it being
Yeah.
implemented to the processed foods which are produced by the food industries or food manufacturers, or specifically only for household consumption?
Yeah, it's looking at packaged foods in Novel 3 and 4.
So it's
Novel
processed
1
foods.
of, yes, processed foods. We are reducing salt, sugar, trans fat, non-sugar, non-sugar, what is it called? Non-sugar additives that are also non-sugar sweeteners that are also used as additives, solid fats. So we are using the standard, the Afro standards, you know, we're following the Afro standard to determine the threshold that we're going to use. So we strictly follow the Afro standard threshold. So whatever quantity of salt, sugar, trans fat, and other of these things are in packaged food. Once they are more than this, there should be an alert label. There will be an alert label on that particular sachet or packaged food that this has high sodium, this has high sugar, this has high trans fat. We call it pack of food label.
Yeah.
So this has to be in the pack. They have to state the quantity that is there and to say that it's above the allowable threshold.
Yeah.
So we are almost rounding up the nutrient profile model in Nigeria. Yeah. Over.
Yes. My next question is, since you have these nutrient profiles, how do you mitigate the response coming from the food industries? Because it may change their formulations, product formulations, acceptance, and so on. Do you have some strategies in that?
Yeah, when we were doing the sodium reduction, we invited the industries when we were doing the I think the second review. We did the zero draft, we did the first review, we did the carcass first, then we did the zero draft, and we did the first draft. So we had already gotten the direction we are going. We have already determined the threshold of salt or sodium in the content, and that it was at the phase of the second draft that we invited the industry. There was a lot of bounce back from the industry, but they come to realize that if the sodium content is reduced by half, because there's a lot of salt being used in their processes, including bouillon and other packaged food. So they realize, we show them that if this is halved, hypertension in Nigeria will be reduced by half. And they got to the understanding, and they came to the understanding, and we're on the same level. So here we are going beyond reducing hypertension. We want to reduce diabetes. We want to reduce obesity in Nigeria, and we will work with them at the next phase. At the next phase of the meeting, they will be invited.
Okay. So yeah, I'm assuming that this kind of response will be coming from the industries, of course, because we changed the formulations, and then of course it will influence the market shares as well, or the sales as well. Okay.
Exactly.
Ms. Adekbita, here we also have another question coming from Pak Rozi Afrial. He's asking, from our understanding, Nigeria has policy to reduce salt, sugar, and fat consumption. Concerning salt, I'm sure that the salt reduction should be not conflicting with the encouraging salt fortification with iodine, as WHO guideline also suggested. The question is, what is iodized salt standard or iodine level in salt in Nigeria? And since the amount of salt intake will be reduced, will you adjust the fortification level of iodized salt?
No, we will not reduce the iodine level of salt, because iodine in Nigeria has helped to reduce thyroid in Nigeria. So we are not intending to reduce the iodine level, but while we reduce the sodium content and add some potassium, which reduces blood pressure, to supplement the quantity of sodium, we will retain the iodine content.
Okay, I think that's clear. Okay.
Yeah, please. I am going for another meeting. I have asked for extra 30 minutes. I told the organizer that I will stay till 10.
Yes.
So I don't know if this is my last question, or
Yes.
Maria can continue to answer the remaining questions.
We believe this is the last question addressed to you, Ms. Adekbita. So therefore, with that, we would like to say thank you to you, but your team will be remaining in here because we are going to have a closing statement coming from KFI, and this will be delivered directly from co-director of KFI, Professor Trajat Martianto. So I would like to give the opportunity to Professor Trajat Martianto. Thank you.
Thank you so much for the opportunity to be here. I greatly appreciate you all, and see you next time. Thank you, and over.
Just hold on one minute, if it's possible. No?
To make
Yes.
Yeah, to make a closing statement from Professor Trajat.
Okay.
Okay, thank you very much. Good afternoon and very good morning, all of the distinguished colleagues in Indonesia and also in Nigeria, our partners and friends. Thank you very much for joining and actively engaging in today's important discussions. Allow me to begin by expressing my deepest appreciation to our excellent speakers, Ibu Puspa and Mrs. Adekbita, hope I'm spelling correctly, which is moderated by Professor Aziz Weng Sitanggang, for their insightful and highly relevant presentations and discussions. So your contribution is really enrich our understanding on how strong data system and coordinated fortification policies can transform national nutrition outcomes. From today's discussion, I would like to highlight three major takeaways that are essential for Indonesia and also, I think, Nigeria journey ahead. First, the critical importance of integrated individual food consumption and micronutrient data system is important. So Nigeria has already proved to us how powerful high-quality data can be when collected comprehensively. So I think Indonesia is now preparing for either 2026 or 2027 National Nutrition Survey, which will integrate anthropometry, individual food consumption, and also the free meals program evaluation. Hopefully it will happen. We just wait until June according to Ibu Puspai, whether it will be done this year, because there is still probability to be postponed again. Hopefully not. So if the survey can be implemented, this will be the only nationally representative sources of individual food consumption data in Indonesia, and it will serve as the backbone for evidence-based policy making, from fortification standards to food safety, from MPG menu to national nutrition targets, etc. Second, data must drive decisions, not merely fill for reports. So Nigeria has already demonstrated how consumption data and biomarker data can directly inform fortification standards, program coverage, and policy evaluation. Indonesia used the survey results to develop policy to reduce salt, and Nigeria has already able to use the data to develop the policy to reduce salt intake, and also in developing the nutrition profile model. So it is a very good example on how we use from survey to become a policy. Indonesia is also moving in the same direction. We expect that 2026 or 2027 SKME will provide essential inputs from assessing the individual food and nutrient and micronutrient individual intake for the evaluation of the nutrient adequacy, and also assessing micronutrient adequacy and or deficiencies based on, we propose actually only 5 relevant nutrients, based on the intervention program. Although at present the PKPK is planned to gather 8 biomarkers. We need the data also for evaluate the effectiveness of MPG, and also to assess the food safety risk, etc. Third, strong collaboration across institutions is indispensable. So the SKME, whether 2026 or 2027 survey, involve a multi-ministerial steering committee, including Bappenas, BPS, the National Nutrition Agency, Ministry of Home Affairs, and Ministry of Health, supported by WHO, UNICEF, and the World Bank. And we know that the process is also gathering input from the wide range of experts from universities, research institutions, NGOs, including KFI. We also propose at least 5 biomarkers that is relevant with the micronutrient programs in Indonesia to evaluate the effectiveness, and also involving our other experts. And this reflects the same multi-sectoral model that has enabled Nigeria's success. We learned from Nigeria that there are so many partners, from reputable university and experts, donors, and other development partners involving in the data collection, data analysis, etc., etc. So we learn a lot from Nigeria, from this case. Ladies and gentlemen, we have learned from Indonesia's experience presented by Ibu Puspa that total day study conducted in 2014 has also provided valuable evidence for policy formulation. And we encouraged by Indonesia's plan to conduct the survey again this year or next year. Hopefully it will happen. Yeah. And then finally, allow me to summarize 3 actionable steps we can collectively pursue after today's webinar. First, ensure that SKME 2026 or 2027 becomes fully integrated into national policy processes, as it has also happened in Nigeria. So the data must flow into regulation, program design, and evaluation framework, especially for food fortification, food safety, for MBG, and other purposes. And the second is establish a sustained Indonesia-Nigeria and South-South technical collaboration. Today should be the beginning between our cooperation, not the end. So we should open avenues for peer learning, joint analysis, and continuous exchange of the technical expertise. And the third, we have to build national capacity for evidence-based intervention, including fortification analysis. So Nigeria success story including bullion fortification, biofortification, rice fortification, and other phasing out of bulk oil, so that strong analytical capacity leads to real policy impact. So Indonesia must strengthen this capacity to accelerate the progress. Dear participants, food fortification and strong data system are not merely technical intervention. They are actually a moral commitments to ensure that every Indonesian child, every mother, and every family has the opportunity to live a healthy and productive life. Nigeria has shown that transformative change begins with strong data. Indonesia is on the same path. So finally, KFI will continue to serve as a consistent, independent, and evidence-driven partner in this journey. And thank you very much to all of the speakers, to Pak Aziz as a moderator, and all participants, Ibu Nina, of course, as the director of KFI, and all partners. May today's discussion serve as a solid foundation for the important steps we will take together. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon and very good morning.
Thank you very much. Thank you very much for Prof. Derajat. By that, Bapak Ibu sekalian, ladies and gentlemen, thank you very much for your attendance in here. Hopefully, we have fulfilled the objective that Pak Derajat just mentioned before. Thank you.
Udah diambil kan, Dek?
Saya percaya bahwa Indonesia Emas 2045 hanya dapat terwujud bila kita menyiapkan generasi yang bebas dari kekurangan gizi.
Saat ini sudah ada 3 komoditas yang sudah dilakukan secara wajib.
Fortifikasi pangan ada investasi fundamental untuk membangun generasi Indonesia yang lebih sehat, cerdas, dan produktif.
Amanat yang penting buat bangsa kita, khususnya untuk memperbaiki gizi buat kelompok-kelompok yang rentan dan juga marginal.
KFI telah memberi kontribusi signifikan bagi program perbaikan gizi nasional. Forum ini telah menunjukkan hasil konkret, diantaranya adalah menjembatani persoalan antara dunia industri dan regulasi pemerintah mengatasi kelangkaan bahan fortifikasi.
Kami memahami bahwa masalah kurang gizi mikro belum banyak mendapat perhatian, bahkan mungkin terabaikan, meskipun program fortifikasi pangan telah dicanangkan sejak lama.
Indonesia masih menghadapi prevalensi kekurangan gizi mikro yang mengkhawatirkan. Berdasarkan survei kesehatan Indonesia SKI tahun 2023 mencapai 22,1%. Angka ini mengingatkan kita bahwa intervensi gizi berskala besar menjadi kebutuhan yang mendesak dan strategis. Dalam menghadapi tantangan tersebut, saya mendorong KFI melakukan refleksi terhadap visi dan misi.
Jadi masalah fortifikasi ini tentu perlu diadakan semacam evaluasi ya, supaya para pengusaha yakin bahwa fortifikasi ini ternyata bermanfaat.
Salah satu tantangan keberhasilan dan keberlanjutan program fortifikasi pangan adalah tersedianya data yang up to date.
Dengan sinergi pentahelix antara pemerintah, industri, akademisi, masyarakat sipil, dan mitra pembangunan, serta komitmen kuat untuk mengatasi tantangan yang ada, saya yakin Koalisi Fortifikasi Indonesia akan terus menjadi motor penggerak dalam mewujudkan Indonesia yang bebas dari masalah kekurangan gizi.